Tonight, with new COVID cases surging to historic highs, frontline workers at Memphis area hospitals are again bracing for another wave of hospitalizations. That's the case at Baptist Memphis, where, get this, of nearly 1,200 COVID tests administered the past 2 days there, nearly half of them, 47%, came up positive. Brad Broders live at the hospital in East Memphis right now for us. Brad, give us a sense of recent trends there.
Well, Richard, COVID patients here at Baptist hospitals surged more than fivefold in the past week or so, from 11 to 59, and that includes a handful of patients who were fully vaccinated. And again, there's concern that hospitalizations here and elsewhere could reach previous highs set in previous surges of this pandemic. For nurses, the work continues and the dedication continues, even as ER wait times and positivity rates are spiking yet again.
The numbers have spiked so quickly.
For Baptist nurse Ann Darst, the Omicron-led surge in recent days is yet the latest test for her and other staff on the local medical front lines.
Healthcare workers have a lot of resilience and perseverance. This is what we are educated for. This is what we're trained for.
Darst said at the ER she works in, average wait times doubled or tripled in the last week, and that's again putting a strain on overall care.
It's a domino effect. When you have so many patients coming in with COVID, the other patients are going to have less time with their nurse and less time with their doctor. The whole system feels the stress.
Well, Darst said she and her coworkers are up to the challenge in what appears to be this pandemic's fifth surge. They're also doing more with less.
Our staff getting exhausted with the labor shortages in 2021, not just in healthcare, but restaurant industry, airlines.
I can assure you it's tiresome for the people who work in the ICUs, particularly the nurses, to sort of deal with this kind of problem again.
Well, Baptist Dr. Steve Threlkeld Wednesday applauded medical workers again answering the call. He's also concerned of what could be on the COVID hospitalization horizon.
The distressing part of it is that we are probably quite a bit ahead of what would be the expected peak of illness, ICU stays, and deaths, because they're going to lag behind, as we all know by now, a couple of weeks from the caseload. And those caseloads are shooting up at extraordinary speed.
Now, to put things in context, the 59 COVID hospitalizations right now here at Baptist Memphis is below the previous highs of 172 set in the spring of 2020 and the 152 set this past summer during the Delta surge. However, 13 of those 59 patients were admitted in the last 24 hours alone. Richard?
That's interesting. Well, Brad, what advice are nurses giving patients if they have to go to the ER?
Well, nurses, first and foremost, are really asking the public for patience. As I just mentioned in that story, staffing is down a little bit and more people are coming in needing medical attention. They also remind people if you're coming here, you might be here for a little longer. So bring phone chargers, bring snacks, and again, be patient. We are continuing to go through this potential latest surge of ER wait times and hospitalizations across the Memphis area. Live in East Memphis, I'm Brad Broders reporting.
Let's hope it's not as bad as before. Thank you, Brad. Still